Allow me to tell you a story. Jerry always knew she wanted to be a doctor. She graduated from med school and eventually made it through her residency program, though her training was so hard with a grueling schedule. She managed to complete it with optimism and hope for a happy life in her chosen helping profession. She landed a job at a teaching hospital. She loved her job, and teaching was an invigorating part of it. She went to work most days eager to collaborate with students, patients, and staff. As a healthcare professional, you may remember that feeling of excitement and zealousness. And then the COVID pandemic hit. Patients were admitted sicker and sicker, and sadly, many did never go home. There were so many patients admitted that the staff started fighting for ICU beds. The emphasis changed from teaching, learning, and relationship building to just pushing patients through, often not knowing the end result of those who were treated, which means there was no emotional closure for staff. Documentation increased so much that Jerry ended up regularly taking charting home with her most days or nights. Work seemed endless. I wonder if you've ever felt that way. Jerry's fatigue dramatically increased, and her energy and emotions couldn't return to baseline. In addition, since she was one of the few female doctors in the hospital, there were often no colleagues to really confide in. Not only did work seem endless to her, but she also felt somewhat alone. Soon she found herself constantly stressed and anxious and taking the tension home to her family. Jerry slowly became distant from her husband and children, trying to find solitude in order to recover and cope. A seemingly impossible task. She became negative and short tempered, far from her normal, calm, and patient self. She soon began to drink red wine regularly to soothe and comfort and de-stress. But the relief was short-lived, and her husband started to worry and complain. At home and at work, Jerry found herself pushing away when a patient or her own husband or kids needed to talk about a problem or upset feelings. It was as if she couldn't cope with any more sadness or upset feelings or problems. There was no room left inside of her, and it seemed as if her compassion and resilience were at level zero. She was emotionally exhausted, discouraged, and thought seriously about ending her career or even her life. You might have felt that way sometimes. Fortunately, COVID pandemic started to soon slow down. The hospital was able to return to its more normalized state, and Jerry finally was able to courageously reach out to get the help, knowledge, and practice she needed to take better care of herself physically, emotionally, and spiritually. She found out she had to protect herself and her family from future stresses and strains of her chosen career. She learned how she must often put herself first instead of last and nurture herself daily. She learned how to better control her stress response system and how to reach out to others when she experienced a traumatic situation. She learned cognitive skills to better keep her on a positive mental track, and Jerry slowly learned to regain the enthusiasm and compassion that had gotten buried in the muck of things for her. And she and her family were very pleased and started smiling and laughing and hugging more. Thanks for listening to this story. This story might have in part even reminded you of someone you know, maybe even yourself.